Today I'm meeting one of my clients who's come to the end of the programme. What he chose to do was to lose weight, become more active and become more involved in the local community. So today we're going to send him out into the wider community where he's going to volunteer to help other local people live healthier lifestyles themselves.
I'd been down to the doctors and it had been at 2 years, near enough, that I'd high blood pressure. At first I didn't really take it serious, because I felt pretty good in myself because I'd give smoking up and that. And when it did click, because they used to be telling me that I were at risk of strokes, heart attack, things like that. So I started reading up about it and what it entailed and the things that cause it. And I realised that they all applied to me, being overweight, my diet, too much sugar in my diet, lack of exercise. Even though I biked it, I realised that biking does a particular part of your fitness, but it doesn't really cover it all. You need to do more than just cycling. For 2 years, I tried myself, plus with doctor, and it had not done nothing. I still weighed exactly the same. So I was really down, you know what I mean? I thought, how do I lose weight? I'm riding bike. I'm trying to eat well. My diet was just blinkered, it were junk food. My idea of eating healthily was salads. And I'd try for 2 or 3 days and say, well, I can't do this for the rest of my life, eating that, and go back on to what I were eating. And I'd been down on Monday to see my doctor, and they were talking about kind of things I could do myself. And I said, what I'd love to do is lose weight. I said, I've seen that poster in the waiting room for this Craig. She says, would you like to meet him? I said, yeah. So she set an appointment up for me. Went down to see him on the Wednesday, and I was telling Craig all about, what I wanted and that. And he told me about this Eat Well, Feel Well course that he was starting at Norfolk House. He says, I think it'd just be nice for you. He said, do you want to go on it? I said, yeah. That was in February. Craig had told me, he said, don't expect too much from the course. Your aim over the 7 weeks is to lose £7, about £1 a week. Met Kellyanne. She told me all about things to do, what to do with me eating, how to eat properly, what to look for. And it totally changed my outlook on living and how to eat. So I found out what I wanted to know about replacing what I had been eating with better things.
We go into supermarkets and he picks every item of food up and checks the ingredients, the saturates, the sugar, the salt. It's done a big change for him.
Zumba does it all, yeah. It works everything, and it's at such a fast pace as well. With Boxercise, we do a bit of training, we have a rest. With Zumba, you're doing it, you have a 30 seconds rest, you're at it. So you go through maybe 8 to 10 songs in 45 minutes. You're using every bit of your body.
I think Zumba is for any age, from young to old, and anyone can enjoy it because it's just, you work at your own level. It's not something where you can work at an advanced level or a beginner's. It's any level because you work how you can work, really. And
now, nearly 5 months down the line, I've lost 32 pounds since February. My fitness has gone sky high. And it's all down to meeting them, Craig and Kellyanne. Because now, like I said, I feel so fit. It's unbelievable. And I'm 52-year-old.
Weight loss and lifestyle changes we try and promote. It doesn't have to be boring and dull. We try and do it fun and help them make friends along the way as well.
Some people say, I can't do it, but by having Steve from the community, he can show that you can do it. He's done so well, so he can sell his story to people, really, and say, obviously, if I can do it, so can you.
At the end of the 7-week course, we were asked if we'd like to become volunteers and health champions. And it's just totally changed, things I do. I've been on a diabetics course. I've been on an Asian cuisine course. I'm a qualified walk leader now. And I'm hoping to go out into the community and help people. And I can refer them on to health trainers. Basically, that's the role what an health champion does. He finds out that what people need. I know that if I ever come across anybody in my situation, I can help them and I can advise them, you know what I mean? I can refer them on and tell them my experience. And I think that'll go down, go down very well with people.